Okay, what is afferent loop syndrome? We used to think when we started the MGB many years ago, lots and lots of patients would get it, and basically afferent loop is the upside of the bowel. Remember that what we do is we take apart the stomach and we put a new on-ramp on the interstate. There's an interstate from your mouth to your bottom, right? And we're going to take apart the connection and put it downstream so that you get on the interstate quicker and get to the destination sooner. Okay. All the upstream gut is called the afferent loop, and all the downstream gut is called the efferent loop. And the question is, what happens to that afferent loop? And the answer is nothing. In most cases. In rare cases, a bad bacteria can set up shop in the upper gut, and then you can get gas and cramps and smelly, very, very foul-smelling bad breath. Almost like, I mean, we're talking bad breath from heck. Cramps, diarrhea, belly pains, things like that, progressive weight loss, malnutrition. And that is usually easily fixed with a course of antibiotics called Flagyl. So if you have symptoms like that, then we should talk, because that could be afferent loop syndrome. And that occurs, in our cases, we've probably seen it maybe 10 times in the 14 years in the 5,500 patients. But when you see it, it's real easy to fix, and the Flagyl makes it better, and you have to take it for a while. But that is a whole set of symptoms for afferent loop syndrome. Dumping syndrome, different. Afferent loop syndrome, really important. If you think you have anything like that, call me. I can help you get that better. We have rarely seen it, but when we see it and we fix it, it's wonderful. So I've had a patient who actually, her mom worked for me. And she was sick for like 2 years. They just never told me about it. And they were doing all kinds of things. They saw GI doctors and all this stuff. So they started telling me the symptoms. You know, cramping, real bad breath, you know, abdominal. I said, oh, it's afferent loop syndrome. And I said, just take some Flagyl. And, you know, after 2 years of pain and suffering, they just took some Flagyl. She was better. So call me.